COVID-19 in cancer patients. The topic of my research was COVID-19 and its interaction with cancer patients. At the turn of the decade, humanity faced one of its greatest challenges yet, a virus which affected the lives of millions, if not more. It would reach the United States in March of 2020. At the time, little was known about the virus and how to treat it. This would lead many to research any correlation between less severe symptoms and medication. This leads to an observational study being done at Brooklyn Cancer Care. This study would observe patients being treated with chemotherapy and the reaction to COVID-19. Throughout the presentation, we will go over the rationale for why we did this research, what methods and processes we used, how we collected data and analyzed it, and what resulted from the data collection, and finally, a discussion and a conclusion. This was a prospective observational study carried out in the Brooklyn Cancer Care outpatient setting in Brooklyn, New York from March 2nd, 2020 to June 30th, 2020. This hematology-oncology center is fully equipped to administer chemotherapy, immunotherapy, and iron infusions in an outpatient setting, and 2 experienced physicians were responsible for administering the infusions. Patients were considered for inclusion based on the following criteria. They were older than 21 years old, they were actively receiving chemotherapy treatment during the rising phase of the COVID-19 infection. Patients that were receiving immunotherapy, however, for cancer treatment were excluded from the study. Those patients who fulfilled this criteria were further observed for the development of COVID-19 symptoms, assuming the odds of exposure being in proportion with the general population. At the end of the observational period, the serum of all the patients was tested for the presence of IgG and IgM antibodies against COVID-19. Using the serum separator tube method at Lineco Diagnostic Laboratory, this study took into consideration a variety of cancer diagnoses and chemotherapy drugs, and the focus was not on any particular chemotherapy drug, rather on the cumulative role of immunosuppression in the generating a response against COVID-19. To gather detailed demographic and medical information of the study subjects, the Institute assessed electronic medical records using Practice Fusion software at Brooklyn Cancer Care. After selecting a total of 35 patients who were receiving chemotherapy during the study period, data was collected regarding their age, sex, cancer diagnosis, and the chemotherapy drugs that were used for treatment. While analyzing the database, the number of patients receiving a single chemotherapy drug regimen, patients receiving a 2-drug regimen, patients receiving a 3-drug regimen, and patients receiving a 4-drug regimen were calculated. To assess the total number of patients exposed to COVID-19 infection, antibody results were then documented as reactive, along with their IgG and IgM titers, and non-reactive. Reactive patients were classified as symptomatic and asymptomatic. Symptomatic patients were further analyzed to see how many developed mild symptoms and how many developed emergency warning symptoms, and how many total symptoms they developed among the targeted 7 symptoms. Also, special attention was given to eliminate similar symptoms that could be caused by any existing comorbid condition. The purpose of stratifying the symptoms was to assess the protective and aggravating effects of immunosuppressions in generating a response against COVID-19. The study subjects were fully aware of the nature of the study and provided verbal consent. The authors vouched for the accuracy of the data. To identify COVID-19 in these patients, they were observed for symptoms mentioned by the CDC. The CDC mentions 2 categories of symptoms based on severity: mild symptoms, which required supportive care, emergency warning signs, which required emergency hospital admission. In this study, the mild symptoms targeted were cough, fever, fatigue, dyspnea, and new onset anosmia. The targeted emergency warning signs were persistent pain, pressure in the chest, and cyanosis of the lips or face. These patients were followed up in subsequent visits, which included both in-person and telehealth visits for the development of any COVID-19 related symptoms, and each encounter was documented in an electronic medical record. After further collecting data about these patients' COVID-19 IgG and IgM antibody response with the help of Lineco Diagnostic Laboratories database. Hospitals currently treat COVID-19 with corticosteroids, Valerie, remdesivir, and monoclonal antibodies. Valerie and remdesivir are 2 antivirals, and monoclonal antibodies attack COVID-19. Corticosteroids are most similar to what we studied here, as they are immunosuppressants. How they help with COVID-19 is they stop multi-organ failure caused by cytokine storm, which is a mechanism which relies on our body overreacting and creating too many antibodies, which then attack the body itself.